Hello there, hello everyone, and welcome. It's great to see so many of you here. You join us for a very important discussion on the key highlights of a landmark study on the social and economic value of self-care. And a warm welcome to everyone who's joining us online as well, wherever you are in the world. My name is Shuli Ghosh. I'm a TV journalist, I'm a moderator, and I'm thrilled to have you joining us today to discuss this topic of the role of self-care in contributing to the health of individuals and in strengthening healthcare systems worldwide. Now, we know that there is considerable pressure on healthcare systems right now. Democratic changes, political instability, and of course the current COVID-19 pandemic. It's really only highlighted just how stretched national health services are. It's clear that there is an urgent need for action, and self-care practices are a key method of reducing pressure on healthcare systems. So, as a bit of background for you, this study assessed the social and economic value of self-care based on two objectives. Firstly, to quantify the current economic and social value that use of self-care products generates for individuals, for health systems, and society globally, with a specific focus on regions where there is a lack of current data, and that is Sub-Saharan Africa, East and South Asia, and Latin America. And secondly, to quantify the economic and social value of self-care, should more products become available without prescription, and should access to more products become available? So during this session, we're going to dive into the key highlights of the study and the evidence of the very real value that self-care has and can have in the future if relevant economic, political, and legislative framework is implemented globally. We're then going to be putting key questions to our panelists here, and we're also going to be inviting questions from the audience, so I urge you to have those ready. So let me introduce our speakers. On my immediate right is Judy Stenmark, the Director General of the Global Self-Care Federation. Dr. Ritu Sedana, the head of the Secretariat at the WHO Council on the Economics of Health for All. Professor Dr. Uwe May, Dean of Studies at Fresenius University of Applied Science. Ben Carrick, Senior Director, Global Consumer Policy at Johnson & Johnson. Kawaldeep Semi, who is the CEO of IAPO, the International Alliance of Patients' Organizations. And Lars Åke Söderlund, the Vice President of the International Pharmaceutical Federation. But we start with two recorded statements from Dr. Magali Rodriguez, the Vice President of the Pharmaceutical Forum of the Americas, and Mazi Samuel Ohubunwa, a pharmacist and the former President of the Pharmaceutical Society of Nigeria, who have both commented on the importance of self-care in an economic context.
Self-care really offers a great alternative to us to utilize the healthcare resources in a better way, and also alleviates the burden in the healthcare system by providing us an alternative for individuals to seek help. One of the other things that I think is very important to highlight is that self-care provides an opportunity to create a patient-centered care system where patients are empowered to really look for solutions and take care of themselves before utilize more costly resources. So the results and evidence of this socioeconomic study help us quantify what are the benefits and efficiencies that self-care can bring to many of our governments in Latin America. I think in Latin America is particularly important because we didn't have a lot of quantitative data that really showed us what impact can self-care have in a healthcare system. It is also particularly important because it's a call to governments to make self-care a pillar of healthcare and really look at what other healthcare providers, like for example pharmacists, what the role could be in helping and empower patients to use self-care appropriately. I think it's really important that we continue this work and that we continue quantifying what is the true benefit, both social but also economic, that self-care can bring. Also, we need to start looking at innovations and really creating innovative campaigns, initiatives that can help us move this agenda forward. So again, I'm very pleased that we have a forum to talk about this.
I am pleased that we're here to discuss matters related to our role in taking care of our health, in being active participants, in ensuring that we enjoy good health, and that we do those things that we need to do to have sustainable health. So often people do not appreciate the fact that they have a role to play in ensuring their health care and the health care of their family and their community. Take care of your health on a preventive level. For example, you need to sleep well, you need to eat healthy, you need to exercise regularly, but also you need to afford yourself certain medications that will help you to either ward off illnesses, prevent illnesses, or manage them. The concept of responsible self-care should be embraced by all, by the regulators, by the practitioners, and by the citizens. We all must work together to ensure that people understand what they can do for sustaining their health care and preventing disease and managing them. We are asking for responsible self-care, and it starts with knowing who you are and understanding how your system works and doing everything in your own power to maintain communication with all the healthcare providers around you, because they can give you good advice which will help you to care for your health, because principally you are responsible for your health care. God bless you.
So two very important messages there. I'm going to hand the floor over now to Judy, who's going to take us through the topic and lead us through the discussion.
Thank you, Shuli. I'm delighted to be here this evening, ladies and gentlemen, for this launch of a landmark global study that demonstrates the value self-care delivers for individuals, communities, and health systems. So, why is this so important? Really because it is the first step to try and get a real handle on the contribution of self-care to our society, to systems, and individuals. This study delves into OTCs and their value, and the reason for this is because there is a lot of data out there about OTCs, their use, how people use them, and their effects. So we have real, tangible data where we could measure the value and impact. But we know that this is just one aspect of self-care, just one thing, and self-care is multidimensional. And so really our next step is to try and combine this data with more research and use these data points to examine the impact of other recognized healthy behaviors for self-care, such as exercise, nutritionals, enhancing health literacy, self-care literacy, and we'll really see an even greater impact and value for self-care in our society. And also we need to perhaps work more with our friends at the Pharmaceutical Society and look at the real value of pharmacists as really an untapped center, if you like, of healthcare professionals in the continuum. So the Global Self-Care Federation is all about empowering individuals to be active self-managers of their health. And if we're going to achieve this, we need to work together with many non-state actors and other NGOs. I just want to highlight the WHO definition of self-care, the ability of individuals, families, communities to promote health, prevent disease, maintain health, and cope with illness and disability with or without the support of a healthcare provider. So over the past 2 years, the Federation has developed various programs and projects to help drive self-care integration and really take self-care to a higher level around the world. Last year, we launched Again, the first of its kind, the Self-Care Readiness Index, and we did that in collaboration with our colleagues at WHO, and this was really looking at the enablers of self-care and the readiness of various countries to adopt self-care policies. Now we're launching the social and economic value of self-care. Recently, we launched as well self-care literacy white paper, several papers last year on self-care and COVID-19, and at the end of last year, we launched another first of its kind, the Charter for Environmentally Sustainable Self-Care for the consumer health industry. But there's more to do. And so I'm not going to go into these research questions because I think Shuli already touched on them. The first one is the current state of self-care and the value and impact of self-care modalities. And then the second one is looking into the future, quantifying future scenarios. So with that, I'm going to hand back to Shuli. Thank you.
Judy, thanks very much indeed for that. It's my pleasure now to introduce Dr. Ritu Sadana, and she is going to take us through the economic role played by health and how self-care can improve public health outcomes.
Okay, super. So first of all, thank you very much for inviting me, and I feel honored to participate in this conversation. And so I think I've already been introduced, so I'll just go right into it. That obviously, congratulations for the new study, and we will hear about it after I speak. But I would like to say that we are all actually doing self-care. I think the COVID-19 pandemic has made it clear that self-care interventions are super important. We've all been asked to engage in personal self-care actions such as wearing masks, physical distancing, as well as now increasingly self-testing. So there's very few people, I think, who aren't aware of actually what this means. So I want to go through some pictures and not spend too much time talking, but at the end hopefully you'll tell me when my time is up. So I just want to put in some context. This figure shows the reasons for lack of access to essential health services by country income group, and it's the most recent available data published by WHO not so long ago. And the figure shows that in low-income countries, about 65% of households that could not obtain essential health services had financial constraints. This is more than triple the proportion of households who lack access to health services because they are just unavailable, which is 20%, but that's also important. So I think the message at the beginning in terms of there are differences across different sets of countries is very true in terms of their access to services. But another reason one could think about is how much investment, I want to make that very clear, that countries themselves in terms of their domestic resources put into health. And this figure shows government expenditures on health as a percentage of GDP over the last 20 years. And what it indicates is that the ratio of government health expenditure to GDP has increased significantly in high and upper middle income countries, the two lines at the top. Mildly in lower middle income countries. However, it has declined in low income countries. There was a decline starting in 2004 and then a continued decline after the financial crisis in 2008. And in fact, on average across low income countries, they have not returned to investing their own domestic resources in health now, at least in 2019, compared to 2004. So this very low allocations did not bode well for pandemic preparedness. And there are different recommendations in terms of how much should a country spend. There's a threshold around 6% of GDP or 15% of national budgets. And that's in order to provide basic services. So the context also, though, is that it's the first time over the last few years that the United States has actually had a decline now successively in life expectancy. So although the investments in low-income countries taken together are low, we also see that really important outcomes like life expectancy are changing in some high-income countries, most notably the United States. So it's within this context that WHO recommends that self-care interventions are for every country and economic setting as a critical path to reaching universal health coverage, the subtopic of our discussion. But we must continue to advocate for greater investment of domestic resources for health and not claim, which we're not, that self-care will replace it all. Practically, this means self-care must work as an extension of the health system so that while people are using self-care interventions, they can also access the health system and community support for further assistance when needed. Now, you've already just heard the definition of self-care by WHO. I'll just note that it defines self-care interventions as tools which support self-care. So these are evidence-based tools, quality drugs, devices, diagnostics, or digital technologies which can be provided fully or partially outside of the formal health services and can be used with or without the support of a health worker. So a few more details. We think of it in three levels in terms, or three components in terms of self-management, self-testing, and self-awareness. And the relevance is across the life course and for all, as I mentioned, for all country contexts. WHO has guidelines that note the recommendations and strength of evidence, and this is available through the WHO's website. You can download them. Things include, for example, reducing personal risk factors, such as physical inactivity or tobacco use, including tools to manage diabetes, for example, self-monitoring of blood glucose. Really critical, important things. Most of the recommendations so far address sexual and reproductive health, having access to condoms, self-injectable contraception, testing for pregnancy, HIV, and other sexually transmitted infections. We think more work is needed in terms of research and evidence to ensure the relevance for older people. My other hat at WHO is that I'm leading the Aging and Health Unit work. This is really important given the monitoring of physical and cognitive capacities, the use of medicines, and also looking at activity levels, for example, through digital or mobile technologies where the information can be used by the person or others. So there are, however, many health system challenges to enable self-care. These include insufficient number of facilities, where we need to obviously increase access through pharmacies, drugstores, home-based care, lack of information which can be overcome through digital technologies, yet this requires that people have health literacy and digital literacy. Rural women in many low-income countries are the ones who are most needy, yet they're also the ones who have the least health literacy and digital literacy. So there's a lot of work to be done. Also, the lack of access by certain populations, and this can be improved through peer and family support and access through facilities or people who normally do not provide health services. And we were just discussing right before the start of this conversation that, for example, in France, postal workers have been repurposed to also check on older people in their homes when they deliver mail. There are many, many other examples. But importantly, from an access and financial perspective, there are high out-of-pocket expenses. And these need to be improved through better financing of health, as well as ensuring new ways of ensuring lower out-of-pocket payments. And I'd like to give an example of this to make it very clear what, what data is actually showing us. So here we see that every year about 100 million people are plunged into poverty because they have to pay for health care out of their pockets. And this figure shows the incidence of catastrophic spending by quintiles, consumption quintiles in households, and the level of older adults' dependency status. So the blue line on the bottom is no old age dependency in the household. And the light blue line is low old age dependency, whereas the red line is high old age dependency. You can see that the two poorest quintiles, and also the middle richer and richest, all have much greater incidence of catastrophic spending. And it really, this reflects data from 133 countries, almost as many as you have in your study. I think you had 150, I believe. But what I think it's important to understand is that we need to consider products and tools that can support older adults. In a separate analysis I led for the baseline report for the UN Decade of Healthy Aging, we estimated that at least 142 million older persons, about 14% of, at least 14% of older persons worldwide, are unable to meet some of their basic needs. So the issues around self-care for themselves or by their families or care providers is extremely important. So what can we do? I just have a few slides and then I'm finishing. Well, I'm very privileged to be the Secretariat head for an independent WHO council that's looking, it's called the Council on the Economics of Health for All. And what they're trying to do is build a health for all economy. Not an economy for GDP, but an economy that actually produces the public good, the public value that actually people need. High GDP is not a goal. A goal is health and well-being can be more than just health, but that's really the goal. And it's also a goal within our planetary boundaries. So the council, who are made up of 10 very well-known economists, led by Mariana Mazzucato, have proposed that we need to value planetary health, social foundations so that we are equitable, as well as human health and well-being. Those aren't exactly new. The SDGs, the Sustainable Development Goals, say that. But what the Council's added value is they're really trying to say we must use the full range of policy levers, including financial and economic levers, from a whole of government and a whole of society approach. And we've come up with a model to think about the root causes, all the way to how to support communities, households, and individuals. And I think self-care has a very high relevance in reorienting and having this new paradigm where we have an economy for health. I maybe in the discussion, I'll be asked some questions and I can elaborate a little bit more. Because we need to really account for everything that makes us healthier and be very clear of all the things that actually detract from health. And right now in GDP, we include things that clearly detract from health. So I just wanted to conclude by saying we need strong stewardship by government, also really strong capacities in government institutions and the people who work in government institutions so that they can lead and shape how we actually get things done with the private sector, with multiple sectors across the government, and also obviously civil society, and self-care demands with active participation of people. So the Council has been looking at scenarios where the public sector often makes significant investments often in very uncertain stages of research, because we mentioned the innovation sector. But the risks then are largely socialized, taken on by the public, but sometimes the rewards are privatized. And that's not always in the public interest. We need to reshape knowledge governance for the common good and introduce conditionalities for public investments to build symbiotic public-private partnerships, as well as the products and tools that are needed to access care at a fair cost. And there's more that the Council writes about this, and basically I want to say thank you, and you can find out more about what we're writing in the various Council themes. I also want to acknowledge that my colleagues from WHO who are working on self-care in a couple of different places in traditional medicine as well as in sexual reproductive health, they've given me a nice list of things that you can then find out more about, so you'll be able to see this in the list that you get with our slides. So perfect, and thank you very much.
Thank you. Thank you very much indeed. Thank you, Ritu. And if you're wondering why I'm not standing behind this lectern, it's because this thing seems to be made for someone who's 6 foot tall. So that's why I'm not standing behind. But luckily, our next speaker does not have that problem. Uwe May, who's going to walk us through the methodology and high-level results of the study.
Well, good evening, everybody. First of all, thanks for the invitation to wonderful Geneva. And it's my pleasure tonight to give you some insights into a research project that my colleague Cosima Bauer and together with myself and our team did in the last month. It was a very interesting and challenging project, and I'm really happy to be here to share some of the results with you. But before I start, I would like to give one remark to your presentation, which I enjoyed very much. I'm an economist, but I totally agree. We don't need more GDP, we need more welfare. And this is also what this project is about and what self-care is about, to generate more welfare, not just be focused on figures and economic factors. Although, of course, now I will present you a couple of figures. So, well, you know the topic. It's the socio-economic study about self-care. And we started our research with a literature review, and this review was split in 2 parts. It was on the one hand an economic and social, the search for economic and social data on self-care. So it was a systematic literature review where we identified all the published economic studies on self-care on a global level. And a second approach was a more targeted literature review where we try to identify any data, any surveys, what we could find, what might be helpful to build our model, and especially to fill data gaps, because you can well imagine that for certain regions in the world, we couldn't find any economic studies which had been done so far. So this was really new, what we did here. And we also had used some global comparative studies, for example, from the WHO and OECD and so on to describe healthcare systems and to compare them. Well, this is the result of the, or roughly I can show the result of the systematic literature review here. And you see here in blue now some studies we found, well, we can say about the issue that self-care substitutes GP consultations. You know, many people who treat themselves, they don't see GP. And that was what many studies were focused about, on the effects of this. So really health economic studies, and we found it very helpful that recently a study like this has been done for Southern America. It was done by the Latin American Self-Care Association. And we also did a study, and Bauer also did a study for Europe 1 year before, which was also, of course, helpful for us now to have the data for all the 30 European countries, and also some approach, some methods we already developed. So this was helpful, and we find similar studies on health economic studies in the US, in Canada, and also in Australia. And in addition to this, we found some more general studies, let's say, on the attitudes of people to self-care, like surveys and so on, for example, for Australia and also for Northern America. But you still see that there are a lot of white spots on the global map here. And of course, this is what we specially focused on. This was the major interest of this study, to focus on these white spots like the African countries and East Asia and so on. So, and let's say by doing this review, but also by observing self-care behavior on a global level, and also based on the studies we did before and our own research, we found that it would be helpful to categorize self-care behavior in 3 classes. So we developed what we call self-care concepts. One of them is self-care, as we call it, self-care as the first treatment option. That means you do self-care, you use OTC products instead of seeing a GP. This is what I talked already about, what is in many cases done in the Western countries and many parts of the world. But there's another form of self-care, and this is what we call self-care as the only treatment option. This is when you use self-care instead of doing nothing. So you choose between just suffering from your migraine or your headache, whatever, or you do self-care. So this is the second path, and the third concept is about, let's say, preventive measures, preventive behavior, without using OTC products. For example, it starts with washing your hand, using normal daily hygiene measures, and so on. Well, you might recognize the first idea, doing self-care instead of seeing a GP, does normally not improve the results, for, the outcomes for patients, because normally if you see a GP or you treat yourself, in the end, you will be healed from your minor disease. So here we have the same outcome, but in the second case, if people treat themselves instead of doing nothing, their outcome might be better. It might be much better than doing nothing, so it is improved, and this is very important for the ongoing story here, that here we can generate welfare effects, quality of life effects, and so on. I will come to this later. And the last category, the third one, about these measures, these preventive measures, this self-care behavior, which is really much more important than the 2 mentioned before, but this can't be measured because it's impossible to measure, for example, the effect of washing hands and so on. But it's an important part of self-care. Well, and let's say in relation to these 3 ideas of how self-care is practiced, we developed, or we categorized, we subsumed all the beneficial effects that might happen by self-care. And as I already said, traditionally, and all the studies that have been done so far, they focused on substituting GP contacts by self-care. This means there is a cost containment. The GP cost can be reduced, the cost for RX products can be reduced. So this is what is normally done in all the studies that we realized, that we found in our review. It's about cost containment. But what we found in the same way important is what happens if people do self-care instead of doing nothing. This might improve their quality of life, and this might improve their welfare and also the welfare of their nation. So these are the two new categories we introduced here and we defined here to measure the effects. And this is especially important for these white spots on the landscape. As I told you that here, many people will not have an easy access to public health care or to GP. So in these regions, like in, let's say, Tanzania or in many African countries, we found that people have almost no access to the public healthcare system. So there is no GP contact which can be substituted. There is no money that can be saved by saving GP contacts. But anyway, self-care matters because quality of life and welfare can be improved. So we measured these kind of effects. We call these the 3 pillars of the social value of self-care. And we measured these effects first on an individual level. That means we did a lot of calculations for individual cases for people in those countries using the economic and social framework conditions in these countries. And then finally, we added these effects up on a societal level to find the results for countries or for regions, as I will present you now. Okay, so this is very important to see. We have these new categories, welfare, quality of life, especially relevant for the low and middle income countries. Well, here is our country grouping to make this health economic model, which was of course a very complex one because you mentioned it, we had 150 countries to cover. So to make this somewhat manageable, we built these country clusters, these groups of countries which are, let's say, comparable, rather similar with regard to socio-economic criteria and also with regard to framework conditions which are relevant for self-care. You can see here the European countries, for example, and North America, Argentina, and Australia are rather similar. And for example, India is rather similar in terms of these factors, for example, to some African countries and so on. So this is our country grouping. And now I think you can well imagine, after what I told you before, that in these regions, the different concepts matter in a different way. That means, for example, if we look at these group C countries, that means the low-income countries, then it's obvious that in these countries, self-care first, that means substituting a GP contact, is not very important because people anyway don't see GP. There is nothing to substitute. This is why we calculated that here, this whole, what we call the self-care first, self-care as substitute for a GP, matters only at 5%. All the rest is self-care. All the rest of self-care that's actually practiced there is self-care instead of doing nothing. That's 95%. And the opposite is true for Group A, where we found that many people, that means rich countries like here, Switzerland, US, and so on, many people practice self-care instead of seeing a GP. That means here we calculated with 40% of this form of self-care. But also in the richer countries, of course, many people practice self-care instead of doing nothing, so 60% are about this. This is what our calculations are based on, and I will show you later the figures about it. So just to put it in relation with the different regions in the world, here you can see in some of these regions there is a mix of A, B, and C countries. And this is why, for example, you can see that in South Asia only 5% of the whole packages of the whole self-care that is practiced actually are related to this substituting of GP contacts. Whereas, for example, in Northern America and Europe, 40% or 30% of all the self-care practices that take place, all the cases that take place, are used to substitute a GP contact. This is what the calculations are based on. And now I will show you the results. Don't be afraid, I won't go through all these figures. But here, just to give you an impression of what we did, we here calculated the effects of self-care as being the alternative to seeing a GP. This is this table. And you see, if people don't see a GP, this is about cost containment. This is about individual time savings of individuals who don't have to travel to see GP, who don't have to wait, and things like this. And last but not least, and maybe this is the most important point, it's about savings of GP time. So we calculated these figures here for the different regions. Let me just mention that, for example, in Europe, you see, in Europe and Central Asia, you see that cost containment is very high. Many people don't see a GP and do self-care, so here it's very important. Whereas, for example, in South Asia, this does not matter very much. In Sub-Saharan Africa, it's the same. People anyway don't see a GP, so you don't see big effects here. That's how this works, but I will summarize these data later on an easier chart. So let me just skip it here, and just to illustrate what we did. The next one was we calculated the effects of doing self-care instead of doing nothing. And now it's, of course, not about cost containment. It's now about quality of life. People can improve their quality of life by treating themselves. By this, they can also increase their productivity. They can run their daily business. They can go to work. They can keep their children, their elderly. They can do their household, everything. That's about productivity. And you see here, 41 billion days, productive days, can be gained on a global level by doing self-care instead of nothing. And this is the status quo. This is right now, what happens right now in these days. And by these gains of productive days, we can also increase, we can also increase welfare very much. And in the column on the right, you see that more than 20 million quality-adjusted life years can be gained by, are already gained today by self-care. So that's a lot of, these are a lot of figures. So let me summarize and make it a little bit easier maybe. Here you can see all these effects again in the status quo. For example, on the left side, you see cost containment right now, 120 million on a global level. And you can see here what is possible in the future. Future for us in our study meant 2030. So we looked 8 years into the future. And what we found, and this is true for all the other categories too, is that we can roughly win 50% more of all these effects if we have a policy that helps to improve the situation for self-care. So 50% more is possible. For example, in physician time savings, and I must admit, physician time savings is what I like to talk what I like most to talk about, because this actually means that today already every single physician on the whole world would have to work, let's say 1 or 1.5 hours more every day if we won't have self-care. And you know, you talked about the aging population and so on. There will be more scarcity with GP time. So as you can see here, we can save up, we can free up more physician time in future, much more, if we have the right incentives to improve the situation for self-care. Well, quality of life, of course, that's what matters for individuals. And remember, these things are effects that specially focus on the white spots on the world map I showed you. In these regions, in Africa and South Asia and so on, we can improve the quality of life and the welfare situation of people very much by even more empowering self-management and self-care. Thank you very much for your attention so far.
Thank you very much. That was really enlightening and great to see those statistics on the results there. Thank you very much indeed. But what does this mean for self-care policies, and how should it impact on the future direction of policy makers? Ben Carrick is here to walk us through that.
Thank you. And before I start with the main presentation, just firstly, thank you to Professor May and colleagues at May and Bauer for the research they did that's facilitating this discussion. Whilst I do work for Johnson & Johnson, today essentially I'm representing a group of colleagues from across the industry who've worked as the Global Self-Care Federation's Economic and Social Value of Self-Care Working Group. So it would be remiss not to thank them for their time, passion and commitment and also to Judy and the team at GSCF, who've put an awful lot of work into this initiative as well, along with all the panellists today. So firstly, it's important as we kind of consider this new socio-economic data that we've just started to hear about, that we also think about the environment and the global context of self-care within which that was looked at. So we know that there's growing interest in self-care globally. We heard earlier, partly driven by COVID-19 recently. That's forced people, whether they wanted to or not, to get more involved in self-care. So there's growing global interest and more work. That said, we also know there are significant differences and variations in the predominant self-care practices and approaches around the world. In some parts of the world, self-care is very dependent on self-treatment with over-the-counter medicines, whilst in some there's a bigger emphasis on traditional and herbal medicines. In some geographies, there's an emphasis on treating self-limiting conditions through self-care, where in other parts of the world there's also a significant emphasis on long-term conditions and chronic disease management. So we also see that there are different drivers to self-care practices based on the differences in healthcare systems around the world. In some parts of the world, as we've started to hear, self-care is partly about being a supplement to well-established healthcare systems where people can find a convenient alternative way to source care. In other parts of the world, it's actually a key substitute for more formal health systems, and that may be due to lower levels and density of coverage of healthcare professionals or geographic challenges with access to services. But what we know is, irrespective of the differences in health systems, the geography, the culture, the prevalent self-care treatment options, government policy and improved health literacy have a critical role to play in the empowerment of individuals to look after themselves and those around them through self-care. Now, I thought this was a simple clicker and I keep getting it wrong. I make no apologies. Yeah, I make no apologies for showing these numbers again. We've just seen them from Professor May, but these are big numbers, they're important numbers. And the analysis that we've heard about, it gets into the productivity, welfare, the quality of life elements that we haven't seen in these kind of studies before. So I think it's really important that we reflect on this. We just heard a little extra detail around physician time and the importance of that. But $119 billion globally is being saved on an annual basis related to self-care. These are big, important numbers at times when healthcare systems are under pressure. But it's also really important to know that based on what we've heard and seen in this study, the future scenario, and we're talking 2030, 8 years from now, if the right conditions are put in place and we grasp the opportunity to support a greater level of self-care adoption, we will see significant further increases. And I've kind of looked at it and gone 50 to 75% more, depending on which parameter you look at, rather than the 50% that was just mentioned. But these are really important opportunities to grasp and some big numbers that can be secured through self-care. Now, we also heard that there was a methodology used in the study of classifying countries based on their profile into 3 groups, groups A to C. Now, it's kind of fair to say that the realisable opportunity to enhance self-care adoption in every country around the world differs. There are some things that differ because of the health, the social, or the economic status. However, in all 3 of these country groupings, there is an opportunity and a corridor of opportunity for any country to improve. So self-care adoption can be improved anywhere around the world across the 3 groups. And it's this opportunity to tap the potential of self-care that will be dependent on 3 areas. One is the economic growth that we anticipate, demographic changes, but also importantly, it's around improved self-care policy and the role that plays in increasing this adoption and the opportunities. So what we all need to do is ensure that this rising tide lifts all boats, or in this case, lifts all countries in all regions. Now, when we specifically think about the elements of this improvement that could come through self-care policy, in the study this has been modelled, and essentially what we come to is that self-care policy improvements could and should play a significant role in increasing adoption. And if you look across these different elements, the 6 different parameters of socio-economic benefit in the study, it ranges between 16 and 25% of the future improvement at 2030 that can be directly attributed to improvements in policy. So when we think about those big numbers on the previous slide, that could mean that in 2030 we'll be seeing an additional $19.5 billion in annual cost savings related to the increased adoption of self-care. If we think about the welfare benefits, it could be leading to an annual increase of $312 billion a year globally. These are significant benefits that are worth chasing and worth grasping, so it's worth working on the policies to generate them. Now, we also saw from this research, this study, that there are 3 levels of policy enabler, essentially, that can support increased adoption or that will significantly increase support increased adoption of self-care. The first one is around access. Firstly, you need to ensure people have access to self-care treatments, self-care options, the right information for them to make decisions, the right support and availability from pharmacies. They need to be able to access a pharmacy, a drugstore, and other things. The second one is more around affordability. And we need people to be able to invest in self-care if we want them to adopt self-care behaviours. If they're living in countries where a higher proportion of people are on low incomes and people are making decisions around food versus electricity or other things, that's going to mean that they haven't got the capability and the capacity to invest effectively in their own health through self-care. So we need to look at those policy measures that support society to ensure that self-care is affordable to people in those countries. And then the third area is around supporting action. And that's about motivating, incentivising, encouraging people to actually take advantage of the opportunity where self-care is accessible and affordable and to actually move to action. And that's about incentivising individuals. It's also about encouraging healthcare professionals to help them address these self-care needs. So there are all these areas that we know can help from a policy perspective to increase the adoption of self-care. We also need to consider that the emphasis will be different in the different types of country around the world. If we take Group C countries as identified in this study, initially the emphasis is going to need to be more around increasing access to self-care treatments, self-care information, and the opportunity to engage to get that support. Then it's going to be around ensuring that people are affordable. But there's no point in focusing immediately around action if people haven't got access and the services and the treatments aren't affordable. Then if you think more about the Group A countries, access and affordability aren't the same level of problem. It's really there the emphasis is around focusing more on the action and really incentivising and encouraging people to make those changes. So, just to reiterate some of the key findings, when we think about self-treatable conditions, there are 2 concepts that have been identified. Firstly, self-care as the first treatment option, generally practiced more in the Group A countries and often as a supplement to developed healthcare systems. Alternatively, it's self-care as the only treatment option, where people are taking that rather than a no-care option or a wait-and-see approach. And that's of practice more often seen in the Type C countries, and is also often used filling gaps in health system coverage. In the Category B countries, it's a mix of things. We also see that in the Group A countries, where it's self-care as a first choice option is more heavily focused on, the real benefits that are coming through in socio-economic terms are more around the time saving for physicians, the time saving for individuals, the reduced burden on health systems and cost savings. In the Type C countries, where it's more of a self-care as the only treatment option, this is where the welfare benefits are really the main opportunity, because it isn't saving physician time if people don't have access to the physicians, but if it's meaning that they're productive, they're back at work, they're able to look after families, etc., then it's those welfare and productivity benefits that really come into play. And obviously, again, there's more of a mix in the Category B, Group B countries. But regardless of this, what we also know is that there is a significant future potential in all parts of the world. And that's really important. And the enablers for that will be demographic change, economic change, but also importantly, self-care policy. So we really need to focus on how do we improve that. And in Group A countries, as we've said, that's around things like incentivising changes and action from people to really adopt self-care policies. In the Group C, it's about increasing access and availability to information and self-care treatments. And again, the need to focus on health literacy to empower people to take responsibility. So, essentially, the results of the study clearly demonstrate that self-care delivers social and economic benefit on a global scale, and regardless of the health system or the demographic status in a country. But importantly, there's also a great potential for increased benefits to be delivered to individuals' health systems through increased uptake of self-care. So finally, some top-level recommendations. And what we'd like to put forward here are the need for coherent healthcare policy and regulation that will support self-care. Those are really strongly required. Secondly, we need accountability and collective action from all stakeholders to ensure that self-care is a key driver in accelerating the delivery of universal health coverage. Thirdly, health literacy is a fundamental catalyst for change to ensure individuals comprehend and act on credible health information, becoming active self-managers of their own health. And then finally, the need for governments to recognise that self-care is a holistic process involving multiple modalities. Thank you very much.
Thank you very much. Thank you. So we've had a lot of information there. We are now coming to the Q&A section of this discussion. I'm going to throw a load of questions at the panel, and I hope that you're going to throw a load of questions at the panel as well. We will have some time for that, but I would respectfully ask all the speakers, please, to keep your answers as compact as possible, because we do want to get through as many of them as we can. So Judy, I'm going to start with you. Because as you were saying, the first truly global study on the value of self-care. Tell us why now, and what are you hoping will come out of this study?
Thank you. And I think, is that on? Yeah. Thank you. I think even before COVID, there was starting to be a groundswell towards self-care and the importance of self-care, and we saw groups like FIP and IAPO really supporting that, but certainly COVID has shone a positive spotlight on COVID. So that's one reason, a positive spotlight on self-care. So that's one reason why now. But the other thing is that, we're all supporters of self-care, I take it, but there is still a lot of opposition around the world towards self-care in various sectors of the society. And if we want to turn that opposition towards support, especially for policymakers, we need to demonstrate the value of self-care in a tangible way. So we need to put some numbers around it for policymakers. And as I said, this is the first step, kind of a top-down approach, but we also need to work from the bottom up, from a community level, especially with things like literacy and self-care literacy.
Thank you, Judy. Rita, you were very eloquent about how health and economy are tied together. How does measuring the value of self-care contribute to this goal that we're all striving for of health for all?
Well, we're definitely advocating to account for everything that contributes to health, as I mentioned earlier. And one of our council members, Marilyn Waring, she's from New Zealand, she's really saying something that is obvious. We should look at time as a metric, because everybody has the same amount of time everywhere in the world. We don't have to adjust it for anything. But if we actually knew what people were doing, and we could provide that as a full accounting of not only their time, but then their status in terms of well-being, that policymakers would actually have a fuller, comprehensive approach to make decisions. So I could give you one or two just quick examples. So if we could account for all unpaid domestic labor volunteering, working at home without money, volunteering, community work, we would have increased the GDP in Australia in 2006, because this is when they did the study, by almost 60%.
Wow.
So I'm not claiming that part of that is, it's not that it's part of that is self-care. It's, of course it must be, but it's another way of looking at how do we know what we're doing and are we getting the value that we really want. Two more quick examples. If you had a wider range of people contributing to solve complex problems. So, for example, in Vanuatu, they did a survey of Melanesian traditional values, and by having that data, it led to changes in legislation in 2014 that restored the land rights and also met the basic needs of like almost 90% of the population, because they understood what were the values that were driving them, that was dealing with not only health but also taking care of the environment. So the care in this respect was not only care for themselves but also for the community around them, and that's part of Health for All.
Okay.
So there's other examples, but I think this is another way of thinking, and that's what we're trying to promote.
Thank you, Ritu. Uwe, let's talk about what this can actually lead to. Based on the research, what are your recommendations on building health economies, better health economies, particularly in low and middle income countries?
I think what first of all can be said that, of course, what matters very much to empower people to practice self-care is that health literacy exists, that they are able to treat themselves, they have the information, they have the access. So it's this is a very first fundamental preposition that has to be fulfilled, and based on this, I guess what we found could support that in of course in the let's say in the higher income countries, switches, RX30C switches are very important. Because here many people already practice self-care, but there are more indications where they can use OTCs maybe, and this is how they can free up more resources in the healthcare systems. But this seems less important in the low-income countries, where it's really more about getting physically access to self-care, getting these products available in the market, wherever you can buy them. So easy and fast access is important, and of course people have to know how to treat themselves. So this is on a very general level what we found. And another point is, and this is also what matters more, I guess, in high income countries, is that we have to focus much more on the right incentives for everybody who is engaged in this game, for every stakeholder. I'm talking about patients first. We are from Germany. Patients, for example, let me take this as an example. They have, in many cases, not a very good incentive, because they get their RX product for free, they get their GP consultation for free. There is no reason for them to choose self-care in many cases. So we have to work on this kind of incentives. And we also have to incentivize all the other stakeholders, for example, the pharmacists, to be more interested maybe. And of course, this is also a matter of economic factors. For example, like we found very helpful examples in the UK, for example, minor ailment schemes, community pharmacy service, things like this, which give a good incentive for pharmacists to engage in self-care. That's what we hope for to be changed. And then the figures, as you also mentioned, the future potential can be, can really be reached.
Okay, Ben, I'll come to you in a little while about the role of pharmacists, but I want to pick up on something Uwe said about patients. Kawaldeep, how does self-care affect patients from a patient's point of view, and how does that play into IAPO's vision?
I think for us it's very important that we want to stay out of the hospital system as much as we can. I think during the pandemic you saw that we've got used to it now, that in the sense that we would like to take care of ourselves much better. But we need to be empowered for that better care of ourselves and then support it through, as you saw, with telehealth and other measures. For us, I think the best outcomes happen when that care is shared, but more self-reliance on that, what we can do. And also, when you're in the self-care mode, I suppose if you're waiting, you start picking up things much quicker and faster. And also, when you do require support, you try to reach out to primary health care first at a very lower level and try to solve it that way and keep the most expensive acute care to bay. So from a patient's perspective, I think it gives us that independence to manage our things, remotely be managed, and only need to go when we need to go to the formal healthcare systems. And that improves outcomes, mental health and otherwise.
Yeah, so it's very empowering for
patients.
Yeah,
very empowering, and I think I don't want to spend a whole day waiting for my appointment. I'd rather take care of myself.
Yeah, and that plays into what Ritu was saying about time. How valuable is time to you?
And same here now. I've got a flight to catch. I'm just trying to see my self-care there now. And I stick to the process. Thank you.
Thank you, Kaldeep. And just to pick up on what Uwe was saying about pharmacists, Lazoka, pharmacists are community-level healthcare providers. How would they be impacted by greater integration of self-care?
Thank you. Yes, I would say that as the most accessible healthcare provider, supporting and empowering patients and individuals to responsibly engage in self-care is actually daily practice for almost every pharmacy or pharmacist over the world. And the self-care spans over a wide spectrum of different actions, you can say, from detection of diseases, immunization and prevention, from minor ailments to actual management of non-communicable diseases. And we are at every sort of area practicing together with our customers and patients every day. And also, it also encompasses advice on healthy living, diets and lifestyle changes, because it's not only about prescribing or giving the correct medicine, it's a whole spectrum of activities that we need to focus on. And I would say that now more than ever, it's an opportunity to actually position pharmacy as the gateway to care, but also as an integrated function within every national health strategy.
I mean, they could have a greatly expanded role, couldn't they?
Yeah, exactly. But I think it has to be written in the national health strategy with clear objectives and also with clear, at least with expected outcomes of what self-care means for healthcare.
Yeah, thank you. Ben, let me come back to you, because the really great thing about this report is that it provides data where previously there had been a real lack of information. What is the unique contribution of this study to the healthcare field?
Well, I think that's one of the areas is if you want to try and engage policymakers in discussions around supporting self-care, you need to give them a reason to do so. And in some parts of the world, we didn't have a socio-economic, health economic argument upon which to perhaps do that. And I think this work has, we talked about blue spots and white spots on a map earlier on. I think a number of those data points are now available, and it's almost an investment model you can take to people now, and I think that's a really important and unique element. But I think we've got to use that to encourage all stakeholders, including policymakers, but all healthcare professionals, industry, and all partners, as well as individuals and the public and consumers and patients. I think what we've all got to do is think about, well, what can we do to make sure we've got the right regulatory and policy frameworks to support the adoption of self-care? What can we do to make sure that we've got the right access and availability to the treatment options and the information to support it? And really also, it's been mentioned a few times, but the importance of health literacy and credible science-based information that empowers people to be able to make those decisions. And I think we've now got an investment case, for want of a better phrase, for parts of the world that we didn't have around welfare, productivity and quality of life data. And I think that's a really important thing that it's beholden on all of us to take that to policymakers and try and encourage them and use it as almost that investment case for self-care.
Thank you. Judy, it's clear that self-care is going to play or should play an important role in universal healthcare coverage. But it's equally clear that the approach to self-care differs according to where you are in the world. So where should we be focusing? Well,
that's a good question. Yeah, we've seen self-care policies differ markedly, even within countries, not just region to region and around the world. But one thing we haven't touched on is that what people mean by self-care, what we think as individuals of self-care, differs everywhere. So that also has to be taken into account in policy, and I think that's an area we need to look at. So policies have to be inclusive and they have to be diverse, but I think we've heard it from nearly every speaker here. Health literacy, or self-care literacy as we're calling it, needs to be a focus of self-care policy. Otherwise, I don't think we're going to get where we want to be. So I think in a nutshell, because we need to keep our answers short, that's where we need to focus.
Thank you. Ritu, we were looking at some of the figures, and it's estimated that enhanced self-care policy measures, I think, can save healthcare systems and national economies $19.5 million, which is an incredible figure. I mean, how do we shape and govern the way in which public and private sectors can work together to achieve that goal of health for all?
Well, I'm going to stress there's an investment that's needed. The first principle for Health for All is that we govern the nature of public-private partnerships from that perspective. And we have to consider the multiple paybacks. And I think in your study, that's been part of what you've tried to expand from previous studies. It would be important that that the conditions that companies who are trying to get into this space, that we help move them away from focusing, for example, on buying back their shares, because that's what shareholders want for greater shareholder value, to actually be driven by the types of products and services that they were meant to deliver and develop, and really ensure that they can reinvest their profits into R&D to develop these new things that we don't know yet what they are. But you know, if 50 years ago a diabetic knew that they would be able to give themselves injections, monitor their blood glucose, have a device which reads so they don't even have to prick anymore.
I mean, all these advances have made such a difference.
So there are many other things out there to be invented and then to be distributed in an equitable way. And that's really, how can we encourage that through policy that encourages these sustainable investments? Maybe we probably need a package of regulations and policies. There's no, I think, one single approach. And I think that this is to bring back these companies to their initial purpose. And a lot of heterodox economists have been talking about this challenge in terms of not having, for example, pharmaceutical companies become financial companies, but to come back to what they were initially, their mission. Yeah.
Guys, I have a lot more questions to ask you, but I'm very aware of time, and I do want to give the audience a chance to ask questions. It's actually very bright here, so if you do have a question, please raise your hand so that I can actually see you. Has anyone got a question for any of our panelists? Lady at the end of the row here.
Thank you. So there was a lot of mentioning of health information, health literacy, and I really appreciate the mention of the role of the governments and policymakers to create enabling environments, not only placing the burden of self-care on the individual. This is something that we also try to emphasize in the work of the IFMSA, but I see in the recommendations that there is a focus on credible data, and I was wondering, how do you ensure and measure how the health data and health information is credible, considering political agenda about certain health topics such as sexual and reproductive health and rights, for which self-care is very crucial in achieving universal health coverage?
Thank you. So this is a question about policymakers. Ben, would you like to take that? the credibility of information on self-care and how that should play into policy.
How do you measure credibility of data considering political agendas around certain topics?
Okay.
Critical data.
So I think, yeah, I mean, I think that is a concern that many of us have spoken about, is there is a vast amount of information available, but you can't guarantee the quality of it all. And I think what we need to do is try and find a way. I don't think it's been necessarily found yet, but I'm not suggesting that every document that goes on the internet needs to have some kind of kite mark for quality. But I guess at the moment that I'm not aware there is a model that means you can easily say good, bad, indifferent to the publicly available information. I think you can rely on information that's peer-reviewed and been placed in journals from credible sources. But I think we all know that a vast amount of information out there isn't from those sources. Honestly, though, I don't have the answer as to exactly how you, particularly on a global level, can implement that process. And I'm
Lars,
not sure
do you want to comment on how pharmacists can also help with delivering, using data and information to deliver?
Yeah, I can take one example, and that is actually a project of mine. It has been running since 2008, and now it's a long-term collaboration with the main elderly organizations in Sweden. It's a project called Check My Medicines, where we used national statistics from prescribing matters for every age group in Sweden and for every community, every municipality. And then we have actually been able to both empower the elderly so they dare to ask tough questions to the doctors, and we have been able to use these statistics, and by these data being able to reduce the number of inappropriate medications for elderly with 50% during the last 10 years. And I think it's one of the most successful, you can say, projects together with patient organizations and healthcare and medicines that we have had actually in Sweden. It's extremely successful, and we have managed to improve medication therapy for 300,000 patients. And it's also almost a role model for the WHO project, Medication Without Harm.
And Carol Deep, did you want to add to that?
Yes, I think it's very important to make sure that much of the data that's been gathered is through expert patients, getting patients engaged in that data collection. I think that improves the inside patient experience is captured with that. I think very often we find that if you don't train up, this is again case of health literacy, you're training actually patients to be aware of the community and their personal data, how to encourage people to share it and make sure that quality is there. So good policy only comes if the policy to whom it affects is engaged with it, and it's very important to that to ensure us. It's for our own benefit that we have to do it, and I think that's a fundamental way to improve that quality. It's in clear sight, and everybody's signed up to it. I may have to leave early, I think, but I could have continued with this. This is a fascinating subject matter. But do follow us online and see what
Thank you for that question. Another question from the audience. Okay, gentleman at the back there.
Hello, good evening. First, I'd like to thank you all for such a comprehensive research and to include high also and low middle income countries and for seeking to relieve the burden from the healthcare system. However, I do have a question, is that by promoting the self-care culture, how do we ensure that we are not promoting self-medication and overuse of vitamins and supplements and creating AMR, as these should normally be prescribed and monitored through primary healthcare systems?
Sorry, so I didn't catch the last part of that. So you're saying by promoting self-care, how can we ensure that we are safeguarding health and appropriate medication?
We are not creating self-medication and increasing the antimicrobial resistance.
Okay,
pandemic.
yes. Who would like to take that?
Thank you.
So increasing self-care is not creating a problem elsewhere. Judy, I mean, this is sort of your wheelhouse.
Yeah, I could start off. I think we nearly every speaker has touched on this as well, but self-care is multifactorial, and this study looked at OTCs, and as I said, because we could look at the data and come up with some tangible data points, but self-care is a whole range of things, and it's exercise, and it's good nutrition, and it's being health literate and self-care literate. So I think how can we ensure that? Well, I think with good policies, we can ensure that it is multifactorial and it's delivering what the individual and society needs. But it's not an easy call, but I think we all recognise, and everyone should recognise, that self-care isn't just one thing, and people becoming active self-managers of their health requires a whole range of policies, but a whole range of actions that the individuals have to take.
Thank you. Another question from the floor. Lady at the end of the row on this side, this lady in the third row. Thank you.
Hello. So to me, I'd like to understand, for example, there is a trend, we're saying that there's a lack of 40 million healthcare professionals by 2030 that would be making even self-care more important for the future. Is this something that we could even factor into your study, because you are saying that there's a saving in time of GPs, but this is accounting current numbers, but this would need to be somehow also be recalculated in the future with this future lack that is going to be very important. So how do you see this?
So possible, yeah. Uwe, do you want to take that question?
Okay, as far as I understand your question, it's about if we can express the GP time savings in a figure that shows how much how much self-care can contribute to solve the problem of the lack of GP time in future, right? And we can, of course, express these calculations we did. We showed you the hours that are freed up, the GP hours that are freed up by self-care. We can express them, and we actually did in the HGP study. We can express this also in terms of, of GPs per year. That means one GP can approximately roughly work 2,000 hours a year, and so it's easy to say 2,000 hours is one GP. And now you can express it in terms of GPs. And actually, we know from foregoing research that it's an enormous number of GPs that we can save. So we have really more access in future to GPs for those who really need them, if GPs don't, let me call it like this, waste their time for treating patients with cough and cold and something like minor ailments. So, but that's easy to express it in this kind of figures.
Ben, I know you want to say something very quickly because we are coming out of time.
I think there's I understand the question, but I think I would be a little nervous at sort of that we were giving a message that self-care is a way to deal with the reduced number of healthcare professionals in future. I think the point we've been trying to make is investments in self-care will reduce burdens on healthcare systems, not so that you don't need to invest in health systems, because we know there's an ever-expanding need. It's about being able to reinvest that time, that cost, into other things. Primary care physicians being able to treat diabetics, more time with them so they have less complications, less secondary care, less tertiary care and things, rather than treating coughs and colds, perhaps. But I don't think we're suggesting this is a solution that drives down the need for doctors.
Absolutely, yeah. It's about empowering patients, not reducing the need for healthcare professionals. Well said. We are almost out of time. I'm going to give our brilliant speakers one last chance to leave you with a key message, and I want only 20 seconds from you each, tops please, to leave a last thought with our audience about the value of self-care and its future uses. Let me start with you, Lars Åker.
Thank you. Well, I think that to enable pharmacists to fulfill their potential in supporting individual well-being and promote self-care inventions, I recommend governments, healthcare professionals, everyone to recognize pharmacy as a core pillar of healthcare system and especially self-care, and support the shift to a new primary healthcare model in which pharmacy is both an integrated actor as well as the gateway to primary healthcare.
Thank you very much. Ben?
I think we now have some data that shows that irrespective of the situation in a country, economically, socially, or with health systems, self-care can be an important driver of improvements in socio-economic factors. So I think we should take this data, share it with all stakeholders, work together to really drive increased adoption of self-care and grasp those benefits.
Thank you very much. Uwe.
Well, to put it in a nutshell, what our basic learning from this study and also from the HGP study is to say that we have to do everything to incentivize everybody who is able to treat himself to do this and not to see a GP, for example, and we have to make sure that everybody who needs a GP will see him. So we don't need barriers for seeing a GP, but we need incentives for more self-care. And we strongly believe that some of these approaches that are used, for example, to bring pharmacists more in the role of being a gatekeeper or pilot in healthcare system are very helpful in this context.
Thank you. Ritu.
Well, I think in times of crisis, we're able to figure out how to get things done. And it's how do we keep that mode when we're not just in crisis. I think many countries during the COVID epidemic, which is not over yet, decided and realized they can use other professionals, other people to support care. But I do have to say, ministers of finance in low-income countries need to ensure that the health sector gets more. Because 1.3%, as I was showing in terms of the amount of public spending of GDP on health, is just too low. That cannot be made up. And I know that's not the message here, but I think that's part of it. Clearly, we also need to realize in some countries, like where I'm originally from, India, something like 70% of all health costs are paid out of pocket. And 70% of that is drugs. So if we're going to have a system which encourages self-care using products that are evidence-based, quality-controlled, et cetera, we still need to have a way to ensure that those are covered if we actually want a vast swath of the population to use them.
Ritu, thank you. And the final word to you, Judy.
Thank you, Shuli. I think we've heard a lot about self-care, why it's important, and why we need to create more self-care opportunities. So I just wanted to finish on something that we have started at the Federation, which is not the journey, but a drive towards calling for a World Health Assembly resolution on self-care. We have strategically decided that this should be our major ambition, and we've already formed a global stakeholder coalition with NGOs, with non-state actors from WHO and others to start this process and start thinking about how we could do it. Now, for some of you who may not know, this is a long road, and we may not even get there, and it may take, if we do, it may take years, but by striving for it, everything we do to try and get there, every policy piece we do, every meeting we arrange, every bit of research we do will really help us to lift self-care up to where it needs to be.
Thank you. Well, I think it's clear that the study has irrefutable evidence of the social and economic value of self-care and that it should be part of a global health strategy. So I want to thank all of the speakers very much indeed for putting your points and your insights there so clearly, and I want to thank the audience as well for your questions. Thank you very much indeed, and it would be our pleasure to have you join us for a cocktail reception in the next room. Thank you very much indeed. Have a good evening.